Hi everyone, we're back, and joining me is local podiatrist, the Shelby Foot and Ankle, at the beautiful Shelby Macomb Medical Mall, 23 in Shaner, Dr. Anthony Giordano.
Thank you, Mark.
One of my newer friends, actually.
Absolutely.
And joining us today, little did you know you were going to have a patient consultation today.
I was unaware that someone in the room had a bunion.
And that someone happens to be our own John Martin.
So we're going to evaluate him later, hopefully.
Yes, and obviously a bunion, for a podiatrist, a foot specialist, is one of the more common things that you see.
Huge amount of prevalence, especially in women because of shoe gear, and a lot of it is hereditary as well. So.
And we'll talk to John. You'll have a little chance to interview him.
I'd love to get my hands on his feet.
And a bunion, really, I would imagine, when you see it, is not just for cosmetic purposes, which I guess some people would be, but John let us know this isn't about cosmetics. I mean, this gives them a lot of problems.
A lot of them are painful. Yeah, they take up room in the shoe, and they create a wider forefoot so that shoes can be somewhat irritating, especially the larger they get. Over time, typically they increase in size. So.
Well, let's let myself get out of the way, and let's bring our newest patient.
Absolutely.
John Martin.
Yeah.
If I knew I was going to be here doing this, I would have had a pedicure. My toes probably look terrible.
Well, it's nice to be able to show something like this to the Shelby audience.
Right.
Didn't know we'd have a bunion today, so. So what bothers you about this, John?
Actually, it doesn't really bother me that much. That's why I've never had it taken care of. The only problem I have is getting shoes that fit. I have to always, shop around very carefully, and there's only a few brands of shoes that will really fit and be comfortable. But other than that, I don't have any pain with it, so that's why I've never really tried to take care of it on a surgical level.
And a lot of times when they're painless, we don't necessarily consider fixing them or repairing them. What it is, if you all at home can see, there's a prominence of the bone behind the great toe, and basically over time this bone will move over. It'll create sort of a V shape to the inside of the foot, and as this moves over and the forefoot gets wider, this will contact the shoe, this bump, or the bunion that we call it, and then it'll either become painful. There can be some cartilage changes inside the joint that would over time increase the pain of that deformity, and then that would typically be a time when we would consider fixing it, when someone was having a lot of pain with this deformity. But a lot of times if you have them, it's good to have them evaluated anyway, to have an x-ray taken to see if there's been any changes to the cartilage, but we don't fix them all. There are typically, as you said, people find a specific brand of shoe or a certain number of types of shoes that have a wide forefoot that they can be comfortable in.
Right.
Yeah.
What's involved in the surgery for a bunion removal?
Bunion surgery is really a large amount about how large the angle is between the head of the first bone and the head of the second bone. And as that angle widens, the surgery to that bone becomes a little more technically difficult. With a smaller angle, we can go in and shave the bump, and sometimes do an osteotomy or a bone cut. We can saw the bone, shift it over, and apply screws into the bone to hold it in place for 6 to 8 weeks while it's healing. And then typically, if it's a larger angle, we can do something in the back, and those surgeries are a little more demanding, and they require some more time off the foot.
Right. But if this isn't hurting me, I should not have surgery.
No.
Okay.
No. Probably a good evaluation to take a look at the cartilage and make sure nothing's getting damaged inside, but other than that, we leave them go.
All right, thanks, Doctor.
You're welcome.
We're back. Dr. Giordano, podiatrist at the Shelby Macomb Medical Mall.
So glad I got to evaluate John's bunion.
Oh, that's actually your lucky day. Okay, and let's talk about your qualifications. How long you went to school and some of the educational expertise that you have.
I went to finish my podiatry medical school in 1999, and in Philadelphia, trained for a few years on the East Coast, and then came out to Michigan into the Oakwood system for 2 more years. So 4 years of residency, and then we decided to stay. My wife and I decided to stay in Michigan and have some family here. Ended up working for another group, left them, and was fortunate enough to be asked by Dr. Moriali to become a part of the Shelby Macomb Medical Mall, and I signed right up.
So you've been a podiatrist for how long?
Since '99, and then in private practice since '03. So about 6 years right now.
Welcome to the end of your first decade.
Yeah, absolutely.
And for the people at home, podiatry, it's a multifaceted thing, but let's talk about the most common thing that you see as a podiatrist. What is the most common condition you treat?
Yeah, we see a lot of things commonly. I mean, warts, you know, we love treating kids, my partner and I. We see a lot of diabetes, as Dr. Martin spoke about. We actually see a lot of heel pain. One of the more common things that we treat is heel pain or plantar fasciitis or heel spurs. Most people think that they have a heel spur. And this is one of the most busy things that keeps our practice going.
You don't treat coughs. I just went over there.
We do. Every now and then I have a family member call me for a Zithromax pack, but
okay, I'm not that.
not typically, no.
So you have a model of a foot, obviously.
Yeah.
And let's talk about plantar fasciitis. I mean, it's a term that probably a lot of people, most people, I would think, have not heard of. Heel spurs, obviously, plantar warts. I mean,
Right.
some of the hallmarks, bunions with John.
Right.
You know, obviously, people have heard the term. So plantar fasciitis is kind of a hot one recently, but obviously, let's say a word they haven't heard of, but it's obviously a condition that's
Right.
outstanding, actually.
Right. Heel spurs and plantar fasciitis kind of go hand in hand.
Or foot and foot.
Exactly. Yeah. The plantar fascia is nothing more than a ligament, if you can see on this model, that stretches from the toes to the bottom of the heel. And with every step that we take normally, this ligament pulls on the bottom of our heel, and it usually doesn't give us a problem. But occasionally, something, either an injury or a bad pair of shoes or a lot of walking or, you know, very rarely a weight gain, because they happen kind of slowly, but we see people over time, if they gain weight rapidly like a pregnant female, you can start to get some heel pain right in the bottom of the heel, and typically the symptoms are very similar across the board. People will have pain when they get up in the morning, but if they walk on the foot a little more, it'll feel better. It may not go away, but it might improve. In some cases it does go away. But after sitting for a little while during the day, if they get back up again, it can start bothering them again. And that's the typical pain of plantar fasciitis, and it usually happens right kind of in the bottom of the heel area.
I know a lot of basketball players would have it now. You know, a lot of housewives have it. I know my wife's had the issue. How common would you say